co-chair of the Senate Rural Healthcare Caucus, I'm particularly concerned on how regulations coming out of your agency work or often do not work for our small and rural providers. We talked about that. And I'm also interested in how we harness their innovation to develop payment and delivery models that are better tailored to their communities and their needs, given their low volume of patients and high number of Medicare and Medicaid patients. I know you're very familiar with that with your work in Indiana. How do we work to include our small and rural providers in quality improvement programs without disadvantaging them due to the unique populations they serve? Secondly, would rural relevant quality measures or different data thresholds be more appropriate to encouraging participation in certain value-based purchasing and or pay for performance programs?
Thank you for your question, Senator. You know, rural health providers have very unique and special challenges. I mean, often they are the only providers in their communities that are providing services. And so when people come to them, they're dealing with a variety of different health issues. It's not just primary care and preventative care. It could be specialty care, and they don't always have access to those services. The challenges for them is that even attracting a workforce and finding providers to come out to those regions is a challenge, and it's difficult. And because they have those multiple challenges, it's difficult for them when there are lots of rules and regulations coming down from the federal government. As a small business owner, of working with small physician offices, you sort of understand that it's difficult sometimes when they're on the front lines and they're trying to manage such very complex situations. To also deal with rules and regulations is difficult. That being said, we want to assure that all Americans have access to high-quality health care. But I think we have to be very careful with our rural providers to make sure that we're not putting additional burdens on them that actually impact accessibility to care or quality to care. So I think when it comes to rural providers, we need to support them through the process. We need to make sure that they have the appropriate technical assistance to get where they need to be, and understanding that the demands that they have on their time might impact their ability to implement those regulations.
I really appreciate that. I think we have 83, probably more today, critical access hospitals, and I know you have the same situation in Indiana. Thank you for your statement. As a member of both the Health and Finance Committee, as many of my colleagues are, we often see a disconnect between new and exciting therapies that are approved by the FDA and reimbursement policies from CNS. Take biosimilars, for example. Last year, only one biosimilar was approved by the FDA, and guidance documents were still outstanding. CMS proposed and then finalized a payment policy that could stifle innovation in this area. How would you anticipate working with the FDA to ensure CMS is developing the best payment policies for patients and providers and the taxpayer?
Well, I think collaboration and coordination is critical within HHS. I'm going to appreciate Secretary Price and his leadership there. Careful coordination and collaboration between similar agencies or sister agencies is important. I think being on the front end and discussing with them, understanding what their intentions are, what's coming down the pipeline, and making sure that CMS is prepared and coordinated with any efforts that the FDA has.
I must tell you that in the rural healthcare delivery system, I'm talking to many of my hospital administrators and the rural providers. You're in charge of CMS. The term used a lot in the past has been, it's a mess. I know you're going to fix that. But there is a CMS's Center for Consumer Information and Insurance Oversight, CISIO. That's the new acronym. I was not aware of that. I thought I knew most of them. It has responsibility for developing and implementing policies and rules governing and administrating the Affordable Health Care Act's marketplace. What role do you see CISIO playing under your leadership?
If I'm confirmed as administrator, my job is to implement the law. CISIO is playing a role with the current law, and so I would look to Congress and its efforts around addressing the Affordable Care Act. And my assessment of the role of CISIO will depend on how Congress decides what to do with the Affordable Care Act. And so I'll make that decision based on the ultimate outcome of Congress's decisions around the Affordable Care Act.
I must say, Mr. Chairman, that I'm impressed with your statement. I know that we have had several senators talk about unraveling of Obamacare. We had an entire insurance company leave the market. We have another one describing it as a death spiral. I think we need to see a rescue team to make sure that bridge is still there, but build new bridges. And I think that would be my take on that. Thank you so much for your testimony, and thank you for the leadership that I know you're going to bring to CMS.